All right, so the last type of seizure we're going to talk about is a generalized seizure, the type of seizure that we're probably most used to hearing about or seeing. And in terms of a generalized seizure, it differs from our partial seizure in the sense that in a generalized seizure, the entirety of the brain is affected. So if you remember from our talk about our partial seizure, what we're looking at is a unilateral hemisphere being involved. So in the partial seizure, unilateral hemisphere is involved, and we're not seeing the entire brain affected. In terms of generalized seizure, patients who are having a generalized seizure are having some sort of neuronal discharge that's going to affect the entire brain. So again, hippocampus is usually the most commonly affected area that's going to cause this discharge. But in the sense of our generalized or tonic-clonic seizure, this activity is affecting the entire brain. So we're seeing bilateral hemisphere involvement rather than just a single hemisphere. And that's why we get the signs and symptoms that we see in a generalized seizure involving all of the limbs, or the entirety of the muscle system. And that's because we see both hemispheres involved. So in terms of generalized seizure, what we're looking at is involvement of both hemispheres, where we see bilateral hemisphere involvement. So another name for generalized seizure is your generalized tonic-clonic seizure. That's the most common type of generalized seizure. And what we see in a tonic-clonic seizure is a progression of stages, and there's generally 5 stages involved in a generalized tonic-clonic seizure. So the first stage that we're going to see is usually an aura. So people are going to say that they have certain thoughts or feelings, certain sensations that are indicating that they're going to have a seizure come on. A lot of the times people will see bright lights, have a certain smell, have a feeling of deja vu, anything that's going to indicate to them that there's the potential the seizure is going to come on. Some people have no aura, but in most cases there is some sort of associated aura. In some instances, it's an autonomic feeling. People get dry mouth, or they start to feel sweaty, or they feel like they're going to be sick. So when we're looking at aura, what we're looking at is a simple partial seizure. So if you remember what we talked about in terms of simple partial seizure, what's happening with these patients is they're starting to have a localized discharge of neurons. So whatever area of the brain is what's stimulating their seizure, whatever area of the brain is the initiating factor, the area of the brain that's going to have that initial discharge of neurons, that's going to result in an initial simple partial seizure. So those patients are going to complain about things related to a localized discharge of neurons because that's what's happening first. So if we have just this area of the brain affected initially, patients are going to start to have localized symptoms related to discharge in that area of the brain initially. And it's going to be something like a simple partial seizure. So that's what we see first is an aura. And again, in most cases, we do have an aura before we have a seizure. The second sign we see is an LOC. So when the patients start to have the seizure, or as the seizure begins, or the entirety of the brain becomes involved, the patient will have a loss of consciousness. And again, if we think about our complex partial seizure, it's the same thing. Once more of the brain becomes involved, we lose the ability to have organized thought, or we lose the ability to have organized cognition. And that's because we're firing all of our neurons at once instead of having localized synaptic function. So all the neurons become involved, and the patient's going to have an LOC. Following that, we have the tonic phase. So this is where a patient is going to end up being having intense muscle tightness. And this is because of basically generalized activation of the neurons. So what's happening is you have firing of all these neurons, and as we activate all these neuronal synapses, what's going to happen is you're going to see the effects of that discharge. So the most visible, or the most kind of prominent physical signs or outward signs we're going to see of this is muscle contraction. So this is where this patient is going to have that intense muscle contraction. So the tonic phase is characterized by intense muscle contraction, and that's because of firing of the neurons. we can see a couple different types of intense muscle contraction, and we've talked about them previously. You can see decorticate posturing, or you may see decerabit posturing. When we talk about decorticate, we're looking at the arms kind of coming up and flexing. So if we take a look at what we would expect to see in someone with decorticate posturing. Someone with decorticate posturing, we're going to see the arms flex. I don't know if we can find anyone who's actually exhibiting it here. This is just an example of someone doing it. But again, what we're normally looking at in terms of decorticate posturing is someone who is going to be lying with their arms flexed and their toes extended. So we see leg extension, flexion of the arms, and what that usually indicates is some sort of subcortical or some sort of cortical damage. So decorticate posturing indicates damage to the cortical regions of the brain. Decerabit, where we see the extension of the arms, extension of the legs, that intense head extension, usually means that we have some sort of subcortical involvement, and that's generally going to indicate a worse prognosis for patients. So it's important to be mindful of what we're seeing in terms of flexion and what that means for patients. So decerabit usually means subcortical, whereas decorticate usually means that it's the upper or the cortical regions of the brain. Other signs and symptoms we can expect to see with someone in the tonic phase is you may hear them yell out or scream. That's as air is being forced out of the lungs. You may hear a scream. You also may see trismus of the mouth, and what that basically is a tightness of the jaw, or basically the patient clenches down with their teeth. So again, you can think about the issues associated with that is now we've lost a potential airway. So in trismus, what we're seeing is the patient biting down in their jaw, and we're not seeing we're not having the ability to enter the airway or get into the airway to make sure patency. So again, trismus, biting down of the jaw, or intense locking of the jaw, which can lead to inability to access the airway. So trismus is common with people who have seizure, and it's usually them biting down. Another thing, or what we're worried about in terms of the tonic phase, is when patients end up in this tonic phase for too long, the primary life threat associated with it is apnea. So if you think about what's happening, is we have contraction of the respiratory muscles because all of the muscles are involved. And if a person can't have relaxation of respiratory muscles, they can't inspire. So if we have this tonic phase, it's lasting for too long, or it's cycling between the clonic phase too regularly, what happens is we have this intense muscle contraction, we have contraction of the respiratory muscles, and the patient basically stays in a state of expiration. They can't have inspiration, and they're at huge risk of developing apnea. The fourth stage that we look at is the clonic phase. And the clonic phase is when we have relaxation of muscles. So the tonic phase basically subsides, and we're going to see some sort of relaxation in the muscles that were just intensely contracted. Patients are often incontinent in this phase because we've had the intense contraction of the bladder, say, relaxation, which relaxes the sphincter, and we can have incontinence associated with it. It's important to note that, again, if anyone's seen a seizure before, they know how a seizure works, or you've seen a video of it. Again, I'd encourage you to watch the videos I post online of the different types of seizures. People in tonic-clonic seizure often have like thrashing movements of the limbs because they go between tonic and clonic, tonic and clonic. And that's generally why we call it a tonic-clonic seizure. You can have patients who are simply tonic followed by a clonic phase, but in general, you see a lot of people cycling between tonicity and the clonic phase. The last stage of this type of seizure is postictal. So in the postictal period, this is when basically the brain is done with the extensive firing. And if we think about, say, having clonicity of muscles or relaxation of muscles, it's almost relaxation of the brain. And it's generally a time that we have increased confusion and lack of awareness. Usually the longer the seizure the patient has, the longer the postictal period is going to be, or the longer the patient's going to be confused. It's important to note that this often takes a lot out of people. Things we could see associated with seizure is a peak in blood sugar if the seizure doesn't last too long. So we have intense firing of muscles, or we're going to have basically a release of glucose as a result of catecholamine surge. And that's because we're using up lots of energy. If you think about the last time you exercise, if you took your blood sugar following that, you probably have a higher blood sugar because we've released it for use by the muscles and by the brain. If the seizure lasts for an extended period of time, then the patient may end up with a low blood sugar. So it really depends on length of seizure and how long it lasts for. It's also important to note that people with seizures can end up in something called status epilepticus. And status epilepticus is basically when someone has a seizure lasting greater than 30 minutes, or they have 2+ seizures without regaining consciousness. And again, the big life threat associated with this is that we're worried these patients may end up in apnea, and they may end up hypoxic. The number one cause of this generalized seizure, or of this tonic-clonic generalized seizure, is lack of compliance with medications. So usually these people are epileptics and they aren't taking their anti-seizure medications. It's important to note that these seizures can happen in people who are not epileptic. And if we see a seizure in someone who's not epileptic, we need to start looking at those secondary causes of seizure, or we need to be aware of what is the actual pathology behind this seizure. Seizure is a symptom in people who aren't epileptic or who are having a secondary seizure of some other pathology that's causing a problem with the brain. So it's important to do a differential diagnosis and find out what's going on with these people. Finally, the last type of seizure we want to talk about is an absence seizure. And really the big difference, again, an absence seizure is a generalized seizure, so we have bilateral hemisphere involvement, but we don't see tonic-clonic muscle movement. So all that's happening in an absence seizure is we have patients who are going to stare off blankly for usually about 10 seconds at a time. What's unique about our absence seizure is we don't usually have a postictal period following it, so they'll stare off blankly for around 10 seconds, and then they'll come back into whatever they were doing before. If you think about it, it kind of sounds almost like a complex partial seizure because what we're having is an alteration of consciousness related to seizure. The big difference between these two types of seizures is that your absence seizure usually lasts only 10 seconds, whereas your complex partial seizure has the potential to last up to 2 minutes and generally lasts around 30 seconds or a bit longer than that. So that's all we have to do in terms of seizures. I'd encourage you to watch the videos in terms of partial seizure and generalized seizure, and really start looking at what you're seeing in each of those videos and recognizing the signs and symptoms of each so that you can kind of compare the pathology to what you're seeing in terms of seizure.